Hello, everyone. This is Dr. Mike Chu, a physical therapist. Hey, today we're going to be talking about how to transition from clinician to educator with Dr. Felicia Ingram. We'll be back in a few seconds, okay?
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
Hello, my Facebook friends, YouTube friends, podcast people. And if you're watching live, comment live. Watching on a replay, comment replay. Today we got a special guest, but before I keep on going and introduce her, check out hellonote.com. It's our documentation system that we use in our private practice. We got, brick and mortar, home visits, assisted living that you go to, retirement home, whatever. You can use hellonote.com for your private practice, okay? And of course, don't forget to use medbridgeeducation.com if you need continuing education units. So speaking of continuing education units, we're going to be talking about that too with Dr. Ingram. But if you need online stuff, medbridgeeducation.com, use the code alternative. You get obviously a 40% discount, not 10, not 20, not 30, but 40% discount. Beat that. And then, of course, the reason why I actually reached out to Dr. Ingram, because she is going to be one of the many awesome, amazing speakers for the upcoming APTA Spring Conference, whatever you call that, festival conference in Nashville. This is going to be happening next week. And I told her, hey, why don't you, come over in our podcast and stuff like that, teach us how you're being amazing and everything like that and leveling up. So before I keep on going, actually, our special guest for today is Dr. Felicia Ingram. She is actually a clinician in the Sports Plus outpatient, actually the hospital outpatient, stuff like that. We'll ask her more. And now she's a program director of the PTA program here at Jackson State University. So without further ado, let's go ahead and bring in Dr. Felicia Ingram. Dr. Ingram, thank you very much again. I know you are a very busy person, and with everything that you do there at Jackson State, and of course in life. Again, could you please tell us again who you are, what do you do, and how can we level up?
Hi, I am Dr. Felicia Ingram. I'm been a physical therapist for, goodness, almost 30 years now. I've worked for West Tennessee Healthcare for most of that time. Just recently in 2022 transitioned over to becoming program director here at Jackson State Community College for the PTA program. I've worked in various settings, just about every clinical setting that we have in our profession. I have definitely tapped into it. So it really helped to prepare me to take on this new endeavor as I try to prepare our future clinicians to go out and to impact the healthcare system overall.
You know what? I love what you said about impacting the future of the clinicians. I also accept students for doctor of physical therapy students from University of St. Augustine in Graceland. And for some reason, I really step up my game when I have students, coming into our clinic. Is if for some reason I'm like, oh, I need to step up. I need to do more. I need to do better because I have students looking at me. Just like my kids, and when I'm, doing stuff at home and then my kids are watching me, I'm like, my tendency is to do better. And I'm assuming this is what Dr. Ingram is doing too. And Dr. Ingram, could you please tell us, you mentioned 30 years of practicing as a therapist, and then all of a sudden you transition to a clinician, to an educator. I mean, was it hard? Was it difficult? Was it a culture shock? I mean, tell us more about how you transitioned. Did you just got tired of the hospital system or the outpatient or stuff like that? Not really forced. What made you decide to go step up and teach the future of our profession?
Well, I've actually been serving as adjunct faculty here at Jackson State probably since, I would say, 2007, I believe. Always loved education. For years, even in high school, I thought that I was going to be an educator, but
Okay.
then switched over, became a physical therapist. But throughout the time that I've been a clinician, I've also been teaching. I have been an international teacher for of manual lymphatic drainage. I started that in 2012, traveling around the country and different parts of Canada, primarily. Ventured over into Austria a little bit, teaching manual lymphatic drainage for years. And so teaching has always been something else that I've been doing in addition to being a clinician. So I've always had a passion for it. And Dr. Jane David, who is the program director here at Jackson State Community College,
Mhm.
had decided to retire and start enjoying family and branching off and doing something different, and reached out to me and talked to me about this opportunity. And I just said, well, I think it's something that I would enjoy doing because I love education. I love learning. I am a lifelong learner, and this is just another way for me to give back to the profession that I love.
Oh wow! Oh wow! There are three things that Dr. Ingram mentioned there, ladies and gentlemen. First is the love and passion for teaching, and she's been doing it for a while. I didn't know that, Dr. Ingram, that you've been teaching and traveling for. You need to teach me those manual lymphatic drainage, right? You got to teach our clinicians at the clinic. We do it every now and then. We don't have a lot of lymphedema patients, but we got like one or two patients that's like that. So you gotta do a CEU class on us on our clinic. But she mentioned about the lifelong learning, ladies and gentlemen. It's very important that you do that. There's a reason why us therapists, that we have the CEU requirements by the state. It's a continuous process. When you graduate, you don't stop learning. The only time you stop learning is when you obviously die. The goal is to keep learning. And of course, aside from learning, is you're applying it. And this is what Dr. Ingram is doing. And I see her all the time. I've been attending their what do you call this meetings at Jackson State, and they're applying it, and they're actually even not forcing, asking their own students to teach. Imagine that. Most of the time it's the teacher who's talking, but when I go there, it's the students who are actually teaching. They're applying it to themselves, so it's very important. So, Dr. Ingram, I know you mentioned, you've done CEU classes, you've traveled around the world speaking, and then Dr. Jane David asked you. So was it hard because I'm sure you miss clinical setting, but and then now you're teaching or sitting down in the computer teaching all these people who don't even know what a MMT ROM, it's like, you don't know this and stuff like that. You're basically teaching high school graduates, and it's like, seriously, you don't know this yet? So was it hard to transition teaching that?
It definitely was hard, because, as you know, from over 20 years ago, even the terminology evolves.
Mm,
That's why one positive to that is, like you were saying, accepting students. And that's what we tell the students in this program, is because they're intimidated by the thought of, oh, I have to go and do a clinical rotation. And they're intimidated by that. But I tell them, and all of the other faculty here tell the students, um, yes, you're going to learn from them, but there's also going to be an opportunity for you to share some new and relevant information to these clinicians that are out there. They're going to be learning from you as well, because with our accrediting body CAPTI, they make sure that the information that we teach to our students is up to date and relevant and evidence-based.
mm-hmm,
And so I'm constantly having to look at the textbooks that are coming out, and looking at our federation, letting us know they're doing the auditings of the textbooks to make sure to see which ones are going to be the best ones for us to use. And we're constantly bringing in those newer textbooks and teaching from those. And so not every clinician has the opportunity to stay in the information to that degree. And so with our students getting the most recent and most relevant information in the classroom, when they go out into the clinics, and the clinical educators, the clinical instructors, they're people that have been out there for years, just like I was. And it's always good to hear when terminology changes, something that we've always called one thing. Now the literature is saying, let's call it something different.
Mhm.
Knowing that the research is now saying that something that we thought was going to be the gold standard, now something else has transitioned over, and they found that something else is more effective for treating different diagnoses. And our students are able to take that information out into the clinical setting. And one of the things that we require of them is that they do in-services at the clinical sites where they go. And so they're able to give in-services to those clinicians. And so, yes, they're the students, but to a small degree, they also get a chance to see what it feels like to share knowledge as well. The same thing that we as educators will do.
Mm.
So it was interesting transitioning over into this realm, because I know you can probably relate to it too. The longer we're out, the more we sort of deviate a little bit from the textbook way
Mhm.
to what we found that works. And we start tweaking it and personalizing different approaches and things. And and the textbook gives you this cookie cutter recipe of how to do things, but being in the clinic, you find more efficient and effective ways to get around to it, to cut through the muddy waters and get straight to the meat of it. And so then coming back into the world of academics, having to go back and remember all the intricate details of everything, and having to even like the anatomy, the neurophysiology, the musculoskeletal, all the intricate details that you don't visit on a daily basis as a clinician. Really, I felt like I was back in PT school as I was preparing to go into the classroom to teach these students.
That's so true. That's so true. It's funny you mentioned that because my daughter is in PTA school too, and she would call me and, "Hey, Dad, what's this?" I'm like, I don't even know what that is." And like thinking I have my doctorate degree and everything. And she's in PTA school. It's like, "Dad, what's this?" I'm like, uh, let me Google it. Stuff like that. Thing. Here we are. It's funny. It's good that you mentioned this, Dr. Ingram, because here we are, physical therapists, and you see clinicians. Nothing against the old clinicians like us. I graduated in 1999, Dr. Ingram, but we still look young, right?
Yeah.
Um, and most of the therapists who graduated, our generation, all they did straight leg racing, leg kicks, knee extensions, stuff like that. And then, and here comes the student trying to implement what they've recently learned. Hey, this is what we do, contract, relax, PNF, and stuff like that. And then clinicians like, no, you do this. Like, we have to be open to it. And even physicians, think of this, ladies and gentlemen, if you're watching again, watching live, comment live, watching the replay, physicians, they have different types of medication. First generation antibiotics, second generation antibiotic, penicillin, amoxicillin. Now they got all this fancy, 3-day, 4-day antibiotic. And then imagine if they didn't accept the new practices, the new evidence base, they'll be stuck in their own ways. And same thing in therapy. We have to learn to embrace the new generation that's coming in, the new techniques that they're learning, and then you collaborate. Gone are the days that you're competing. You're collaborating, and yet the student is learning from you as a CI, and then you as the CI learning from the students because I learn a lot from them, Dr. Ingram. So on that note, Dr. Ingram, w- w- do you have lots of students applying for PTA school? Because we do have a lack of, we're lacking therapists. We need more therapists out there. So, do you have a lot of students applying? I mean, how are you sharing the good news of it and everything? So,
That's one of the things that across the state, program directors, we get together and we discuss what we're seeing in each of our programs. And I will say that across the state, we have seen over the years, we've seen a decline in the number of students that are applying into
mm,
these for our PTA programs. Um, we do have a substantial amount that are applying, but in comparison to what we were accustomed to even 10 years ago, we have seen a decline. We're trying to get out and educate as much as we can. We're doing a lot of informational sessions. And one of the things that from the educational standpoint, the research is showing is we are able to have more impact, a greater impact on students if we start going out and educating them at like the 8th grade level, as opposed to,
Mm.
for years, it was always go and talk to the juniors and seniors in high school. Well, now what they're saying is we need to start as early as 8th grade,
Wow.
because by the time they get to be juniors and seniors, it may be too late, because some students, based upon their socioeconomic backgrounds, or so many other determinants that can impact their decisions on what they will do in the future. Some of them, by the time, coming from middle school to high school, you see a lot of first generation college students. And some of them may feel like I can't afford it, or some may feel like I'm not qualified for it. So if we can get them at the 8th grade level, then what we're able to do is show them that, especially colleges like Jackson State Community College, you can go to school for free. There's a
Mm-hmm.
lot of people that don't know that.
Mm-hmm.
You can get your PTA degree for free by
I
coming through
know.
Jackson State. But whenever they come into high school and they think, oh, college is not an option for me, then they don't strive as hard to be as successful as they need to be. And so that can impact their ability to get into programs like this. But if we get them at the 8th grade level and let them know this is possible, it is a goal that is attainable, then they can start ramping up and doing everything that they need to do to prepare themselves so that they can be a viable candidate for our programs in the future. So we're going out into the middle schools. We're doing informational sessions through Zoom and different things. We have a team of people that are going out throughout the state on a weekly basis, almost talking to different schools, doing everything we can to let them know. One thing that was sort of scaring people away from the profession is, how our profession has been over the years. You and I have been at it about the same amount of time. We have ebbs and flows. There's times when the job market is looking great, and then there's times
Mm-hmm.
when it looks like it's dwindling down a little bit. And with most recently, with all the legislative things that we're dealing with, like the 15% differentials for PTAs and things like that will impact. And whenever that information goes out into society, and is not kept in proper context, then people will think, oh, it's a dying profession, when in
Mm-hmm.
actuality, it's not.
Mm-hmm.
You look at the job outlook, our profession is projected to grow and continue to grow. And just like you were saying, and what I see is I'm getting people reaching out to me asking, hey, can you let your graduates know we're looking for someone? Can you let your graduates know we're looking for someone? But, if you aren't putting that information out there, then people don't know. And we're needing everybody to help us to spread the word that there is viability in this job market. So it would not be a waste of your time to come into this profession as a PTA or as a PT, whichever realm you want to come into it with. And the other thing that I try to tell students to look at is, just because, if, say, for instance, if you're looking in the West Tennessee area, if the West Tennessee area job market doesn't look that productive, then don't just base it on the West Tennessee area. Look
Mm.
further, span your reach, because it may be slow in West Tennessee, but it may be booming in East Tennessee.
That's
Uh,
true.
so we've got to look at it from, a statewide or even a national standpoint as we make
Mm-hmm.
decisions on what we're going to be doing.
Well, it's funny you mentioned that you look at it on a in a bird's eye view. When you're asking, we're streaming this in the alternative healthcare career group. We do have, like, I think around 50,000 members in this group that's are looking for alternative career. But most of them, they would say, hey, I can't find a job. But of course, they're in, let's just say I live in Martin. You really can't, you will never find a job here in Martin, Tennessee. So you will have to venture out.
Mm.
I came from the Philippines, and obviously the job market there is, it's bad. So I had to get out of the country. And what happened is that I had to get out of the country, went to the United States. Did I go to New York? No. Yes, I went there. Did I go to a big city in where? let's just say Nashville. No, I went to Martin specifically because there was one company that is needing me here. So I went here. But if you're going to ask, hey, is there a lot of opportunities in Martin? No, not a lot. So you will have to have a bird's eye view. And this is where the school comes in. They have the bird's eye view. And sometimes we look at in a small view, in a picture, just like what we're doing right now. This one, you're looking at a wide view and close view and a much closer view that you can see my pores, if that made sense. So sometimes you have to go look at the bird's eye view like this, and then you will see the opportunities out there. And let me ask you this too, Dr. Ingram. So aside from the settings, I know you talk about this a lot in school. What are the different settings that a PTA can really do? I know we all know nursing home. You all know outpatient. What else are the other settings that a PTA or a PT can do? Can you talk
Oh,
about that too,
there's
real quick?
yeah. I mean, we can in the school systems. Uh, I've worked in that setting. We have PTAs that are working in that setting. The pediatrics, like the Therapy and Learning Center here in Jackson,
Hmm.
Tennessee, and other pediatric settings throughout the West Tennessee area, throughout the Tennessee area. So you have pediatrics, you have, like you said, the nursing home, the skilled nursing facilities, the inpatient rehab facilities, hospitals. Traveling is another lucrative area that PTs and PTAs can go into, preferably after you've gotten a little bit of time under your belt before you start traveling.
Hmm.
Home health agencies, same thing. Hopefully, you'll spend some time because with traveling and home health, it require to me, it seems like it would be better. You would have a better experience if you have a little bit more clinical knowledge
You're
under
by
your belt
yourself.
before you go into those into
Yeah, you're by
those.
yourself. No nurse to
Yeah, you're
call,
by
no doctors to
yourself.
call. It's just you, right?
But there's just a vast array of different settings that you can go into. One of the other areas that I worked in before coming into working at Jackson State was um, oncology setting. Uh,
Mm,
the cancer centers. Those are areas that PTs and PTAs can go into. The industry. There are some
mhm,
industries because they're trying to decrease the amount of money that they're spending on work comp cases. They're bringing PTs and PTAs into their industries in order for us to hope more so from a preventative standpoint.
mm.
But even if something does happen on site, having someone in our profession there that is from a physical therapist standpoint, having someone that can be that first point of entry to be, because as doctors of physical therapy, we're able to assess situations and determine, is this something that is within our scope that we can treat? If it is, we treat it and they get better and they go back to work. If it's something beyond our scope, if it's a fracture or something that requires some further diagnostics, then we're trained to be able to analyze that and to be able to diagnose that and refer them out quickly. But what we'll see a lot of times is we end up being a great resource for helping to cut down healthcare expenditures because, with the way that it was formatted, 10, 20 years ago, you had to go to your primary care physician. That person had to refer you to a specialist. Once you saw the specialist, then that person turns around and says, okay, try physical therapy. Well, by that time, how much money are you have you spent on doctor's visits and things like that and diagnostics? Whereas now, because of direct access, people can come straight into us as physical therapists and we can do assessments that can let us know, is this something that we can treat with our skill set, or is this something that we can refer out for something else? And we're able to help decrease cost, and we're able to help people get back to their daily activities, and also in the from that standpoint of being able to go back to work to generate the income that they need. We're able to return them back to sports, return them back to work at a much a quicker rate, rather than having to go through all of these visits before they come to us anyway.
That's so true. That's so true. I love what you said about prevention and wellness. I'm reading a book right now about it's called On-Site Physical Therapy, and the author, I forgot her name. Sorry about that, but she's based in Colorado, and she's doing on-site physical therapy inside companies.
Mhm.
There's no insurances, there's no middleman. It's basically you being on site for that company and doing actual, direct access services. And of course, you can either work for a certain company or you directly contract yourself. And it's basically ergonomics.
Mhm.
And a lot of therapists, PTs and PTAs are already doing it, and it's a untapped market. And here we are, we're only focused on the nursing home and the outpatient, and there are a lot of other niches that Dr. Ingram is mentioning. There's people who are doing lymphedema specialty, just plain doing that. Pelvic floor therapy.
Mhm.
What else did you mention? There's a lot of niches. I mean, of course, in our clinics, geriatrics, we just treat seniors. That's it. When we probably have one 15, 16-year-old because her parents really wanted us, stuff like that. But we just mainly focus on seniors and balance program. And there's a lot of niches there. There's so much opportunities and potential for our profession, ladies and gentlemen, that it's not doom and gloom. The population is getting older, and they still need us. All right, whether it's via the insurance or Medicare or cash payment or whatever kind of a payment source, they still need us. The question is, are you willing to step up and continue to do this and serving the people what we were called? Because many are called, but few are chosen. And if you're here right now, you are one of the few chosen one that will take care of this population. Dr. Ingram, I know you're very busy. Any last parting wisdom for our people out there? How they can reach out to you and talk to you and stuff like that. When can we find you? And what is the topic that you're going to be talking about next week on the APTA Spring Conference?
Yeah, we're having our spring conference, APTA Tennessee. It's going to be at Belmont University on March 22nd, the 23rd. You can register for that conference on the website, tptatn.org. But I'll be doing a presentation on strengthening the therapeutic alliance between provider and the patient, which is a focus on patient factors. Um, what the committee that I serve is the Diversity, Equity, and Inclusion Committee, is one of the committees that I'm on with APTA Tennessee. And what we're wanting to do is offer this continuing ed course, um, putting an emphasis on trying to create a strong therapeutic alliance between a provider and a patient, understanding that it is one of the most important factors in the success of our treatment. And when we talk about therapeutic alliance, what we're talking about is you're taking that clinician and you're taking that patient and you're doing what insurance companies have been begging for us to do for years, doing a collaborative goal setting. Because the best way to get your patients to buy into therapy is to let them have some input on the goals that you're establishing for them. Find out what it is that they want. Why do they want to come? What do they want to accomplish? So collaborative goal setting, shared decision making, so that, we're not, even though we may know what's the best thing to do in that treatment session or how we want it done. If you look from therapist to therapist, you'll find, just using an old cliche, there's more than one way to skin a cat. Just understanding that we all have our own ways of doing things. And it's not to say that your way is better than my way. It's just a different way. But the question is, how are we all going to come to the same conclusion? That's the ultimate thing, is reaching that goal and allowing the patient to be able to say, I'd like to start on the bike today, or I don't feel like doing that today. And sitting down, having a discussion to find out what is it going to take to get them to buy into it. Because if we can start doing that, then what we may start seeing is that no-show cancellation rate may start decreasing in those clinics. And then just a therapeutic relationship. One of the things that we're looking at from that standpoint is patient factors that can impact our therapeutic alliance, like their cultural backgrounds, socioeconomic statuses, mental health history, trauma history. What are their expectations for therapy? Those are just some of the things that we'll be talking about during that continuing education session. But there's a great lineup of speakers. We will be giving out awards during our chapter business meeting on that Saturday. I'm the awards committee chairperson for the state, and I'm proud to say that we do have West Tennessee is going to be bringing some awards home this spring, and I'm excited about that. So
Wow.
if you have the opportunity to come to Belmont, please try to join us. And I also want to let you know that even here in our Jackson area, we will be having an ethics and jurisprudence course that's sponsored by our Jackson district. That's going to be held at Jackson-Madison County General Hospital on April the 13th. That during that morning session, starting 7:30 for registration. You'll find registration information on the TPTA website if you want to register for that as well. But if you need to get in touch with me, you can reach out to me here at Jackson State, 424-3520, or you can email me at fingram3@jscc.edu. I'll be more than happy to share whatever information I can with you.
All right. Again, thank you very much, Dr. Ingram. I appreciate you. But before I let you go, ladies and gentlemen, always remember the word FAST, F-A-S-T, letter F. Find people that will bring out the best in you because you are the average of the 5 people you hang out with, right? Today, I hang out with Dr. Ingram, and I've been hanging out with in their group, the Jackson State group people. And I was like, yeah, I feel like I want to be like them, right? The popular kids of Jackson State, right? So find those people because again, you are the average. If you're hanging out with people who are like always complaining, guess what? You'll end up complaining too, right? You hang out with people who are winning, just like Dr. Ingram. Guess what? You will eventually win too. Basketball players, they do that all the time. They team up with other people and then they kind of win, whatever conference championship, basketball championship, right? Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Dr. Ingram good if you don't take action. Take action by reaching out to her. Go to their website. Register in their CEU classes. Register the ethics and jurisprudence. Take action. Because imperfect action beats perfect in action. A lot of people like to analyze, and then they get to that analysis paralysis. Take action, guys. And next letter is letter S. Shoot for the moon because you're going to be landing with the star. So you keep shooting for the moon, you're going to miss it. And eventually, you're going to be landing with the star. Today, I land out with the star with Dr. Ingram, right? And last but not the least is letter T. So you teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like Dr. Ingram is doing, you're actually understanding it more. That's the beauty of teaching. You're going to understand it more. Again, thank you very much. Be awesome. Be great. Be excellent. And we'll see you again in the next episode of the Alternative Healthcare Career Show. You have a good night. Bye-bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal